Hi, I'm Steve Swidler, and I'm very excited to be sharing with you a technology that comes from information that I've learned over a long period of time and come together with different people who could fabricate and design technology that will alter all of our lives from this point forward. I'm sure many of you can look at this and recognize the percussion hammer as a very useful tool that when you use it on a particular joint and you've been trained to feel in the body, you can feel the whole area unwinding like on fast forward and releasing. I always wondered, I had my first cranial course with Dr. Viola Fryman back in La Jolla when she was teaching 7 people at a time. And in '79 I went to my first advanced cranial course and met Dr. Bob Fulford. And Bob taught me the use of the percussion hammer because as a dentist I didn't feel comfortable doing adjustments on the spine or other areas that I knew had a lot to do with how this jaw and head and neck were functioning. So Dr. Fulford taught me the percussion hammer. It was very useful. I would spend with new patients an hour and a half to 2 hours, work all the various joints and get amazing releases, work from the tail all the way up to the cervical areas, and then do cranial work. Well, I kept wondering during those years, 1980 on, what would be the effect if I was this tall? If this percussion hammer was somehow able to pulse my entire body at one time, globally. And it wasn't until 1996 that I had the courage to go talk to Dr. Fulford, and it was 3 months before he died, and I told him my idea, and I said, Bob, the whole body will get pulsed at the same moment. This isn't a twin hammer technique. There won't be alternating ways, but the whole body will get pulsed at exactly the same moment. And he gave me his blessings, and actually I think he's one of the angels on this project because it works incredibly well. Learning cranial work has been one of the greatest gifts I've ever received, and so this is also my giving back to the profession of cranial osteopathy, as well as to dentists like yourselves who want to learn a technique that will take all of our work and really boost its effectiveness. So what we have here is the percussion table, and the percussion table has a floating top. You lay on a memory foam pad that adjusts to the hollows of your body, so as much of your body can be in contact at one time as possible. We're designing it to go down to 18 inches. This is our 9th prototype. Earlier models, each one we're learning from what improvements we can have. The table can raise up or lower so that somebody in a wheelchair could just drop in on it. As you see, it's built very stout. There's a driver mechanism underneath it that takes this whole top and creates a pulse that can be adjusted by both frequency and amplitude. The amplitude is stationary on the percussion hammer, but you can dial it into whatever that person needs. And the results have been much more than expected. As a matter of fact, this prototype works better than any of the prototypes that we've had so far in terms of its effect. So that's a real bonus. It works particularly well for people who are in pain. The hardest people for me to work on were the very obese, the muscle-bound athletes, and the elderly. And for those populations, this works incredibly well. As a matter of fact, for 5 years we've had osteopaths and chiropractors coming here to the desert in Tucson and evaluating people before and after 12 minutes on the table without even doing any cranial work on them. Devices that are available for us to use either before or after our adjustments will change 5 to 8% of what a chiropractor or osteopath would find is out on you. And we just have them check people before and after. There was once a device that would clear 12%. The percussion table is clearing between 80 and 90% in 12 minutes, which means that all the background noise, the compensations, the restrictions that we've all healed through the layers of the onion are all of a sudden released and revealing the underlying 10 to 20% of the primary injury patterns. So for dentistry, I picture these in, just like we have a hygienist in one room doing great services, I picture a craniosacral therapist or a myofascial therapist or a physician being able to have somebody on this table, and then just in itself, a person gets off feeling like it's the third day of vacation. If people couldn't bend over and tie their shoes, they can now tie their shoes, they can stand up straight, elimination of pain even for acute problems. So I'm excited to make this one of the technologies that you'll be learning about in the future, and you're welcome to come down to Tucson and join us and not only have the experience, but we're working towards producing more of these. So thank you very much.